Good afternoon, Dr. Ramakrishnan. How are you?
Good
Dr.
afternoon.
Ram, as they call you.
Doing fine, thank you. I had a good night's sleep.
Excellent, excellent. That's what we're going to talk about. Um, we go a long way um, in our, relationship, and I know we are alumnus of same university in USA in critical care, and then you've done sleep specialty as well. And something very unique about you is that you have moved back to India after training and working for a few years in USA, and you established very, very successful critical care as well as sleep practice, which is, I'm sure, when you came was very, very nascent, especially this sleep field. So I feel that you're in a very unique position to contribute to both sides, what the problems are, how are they different. As you know, sleep is everybody sleeps. Animal sleep, human sleep, that's very essential part. So I want to start with some basics and ask you, what is sleep, and why is it important?
Uh, Before I get there, since you mentioned about me coming back, I do want to say that when I came back, a lot of people, including my own close family, were wondering. My father used to ask me, why didn't you do some cardiology or surgery or something that everybody would understand? And you're coming and saying you're going to practice sleep medicine, critical care medicine. Do you
What
think
is it?
But do you think people will come to you? That's how it started. And to be honest, like when I started, my critical care obviously was busy because there was a patient base from a large hospital system like Apollo Hospital. But for the sleep, I used to see by appointment maybe one patient a week or something like that. And we have evolved over the years. In the past, we've been practicing here now for 20 years when I established Nitra Institute of Sleep Sciences in 2004. So now we're
Ah,
almost in our 21st year. So we've come a long way. There is definitely more awareness on sleep disorders, more awareness on the importance of sleep being understood by everyone, the common man. But still, I think we are only seeing the tip of the iceberg, and the number of specialized people are still far and few. Therefore, sometimes people are lost on whom to see, how to really get the right kind of care for their problems. So with that background, I do want to start with saying, we have recognized the importance of sleep right from ancient literature in so many ways. And, the mythology talks a lot about different kinds of disorders. Dr. Seuss talks about sleep disorders. So,
yeah.
everybody understands the importance of sleep and sleep disorders. But most people
Want
think
to interject and give credit to our ancient wisdom. As you know, even in our sleep medical textbooks, they quote our Mandukya Upanishad and the four states of sleep. In the Mandukya Upanishad, they talk about four states of consciousness, and it has to do with thoughts and awareness. Jagrata Avastha is the wakeful state where you're fully engaged with the environment and you have thoughts and you're engaging with the environment. And Swapnavastha or sleep state is obviously you're sleeping, and you could have dreams, and basically you are not aware of your surroundings, but your thoughts are there and you're still expressing and experiencing them. And the third one they described was sushupti, where it's deep sleep or dreamless state. And the fourth one, which I think very few in the West have recognized or elaborated, is the Turiya Avastha, which is really the enlightenment state or, thoughtless awareness. And, that's something very few people experience. But, I'm really, the more we read, I know it has made it to the sleep textbooks. The more you read, you just see thousands of years ago how our rishis and they had the clarity of thought about sleep, which was such a unique and personal experience. It's not something you share, it's a personal experience, how they elaborated. So I just wanted our audience to know and feel very proud of
No,
our
absolutely. And,
yogis.
like we talk about the states of consciousness, and if you think about it, after so many centuries, so many hundreds of years, we are back to saying that now sleep has four stages, and again, when we talk about sleep, people think of it as just as a state of temporary loss of consciousness, or people think of it as just a state of rest. But it's a very, very complex biological, phenomenon that goes on. So many changes are happening, which is exactly what you were highlighting from, the ancient Upanishads and scripts. So to start with, I would like to say that, we go through 4 stages of sleep. And normally, when we sleep about 6 to 8 hours, approximately every 90 to 120 minutes, we go through what is called the REM sleep, or the rapid eye movement sleep. In the rapid eye movement sleep, our entire body is paralyzed. I mean, the body is not moving. The muscle tone is significantly reduced, but our eyes are moving. And this happens roughly every 90 to 120 minutes. So in a 7 to 8 hour sleep cycle, we get this approximately 3 to 4 times. And the interesting thing about REM sleep is the initial REM sleeps are very short in duration, usually about 5 minutes to 15 minutes. But the ones early in the morning are much longer, about 30 to 40 minutes. And another interesting trivia about REM sleep, we were talking about the dreams, is that dreams that happen during REM sleep are what we can remember. The dreams that happen during the non-REM sleep, which has 3 stages, and 1, 2, 3, we don't even remember it. That's why when we wake up sometimes in the morning, we have fresh in memory some of the most recent dream that we just had. So that's how, we think about sleep as far as REM cycle. And then the non-REM sleep is predominantly, stage 1 is extremely light sleep, which is only about 3 to 5% of our sleep in the night. Stage 2 sleep is what we spend most of our time in. And that's about close to 50%, 45 to 50% of our sleep. And then we have the stage 3 sleep, which is the N3 sleep, which again is a deep sleep that we go through. And a lot of hormonal changes happen during this. And the first half of our sleep is dense with stage 3. The second half of our sleep is dense with REM sleep. And why this is important is there's a lot of growth hormone surge that happens during stage 3, which is why, again, like talking about ancient wisdom, the good old grandma used to say that, the child should sleep well to grow well.
Yes.
And the purpose was that the growth hormone secretion happens during the stage 3 sleep.
And REM sleep, I think a lot of people are familiar with it. Can you tell us the importance of REM sleep, other than your body is paralyzed because you don't want them to act on the dreams. Like if lion is changing, you don't want to jump out of the window. But there is other physiological importances.
Yeah. Lot of, again, hormonal changes, lot of blood pressure changes, and all of that happen during REM sleep. Again, there is, our flight and fright hormones, adrenaline, and then the, other cholinergic hormones. They're all, changing in the quantities, and that is important, which is why, the quality of sleep, the amount of REM sleep that you get is as important as the quantity of sleep. It is not just having 6 to 8 hours of sleep that matters. In fact, a lot of people who sleep that duration still say that I don't feel fresh, or their blood pressure goes up because, like they are not having enough of those changes. And again, it is, not only the internal rhythm of this different stages of sleep that matters, but it's also when we sleep, how we sleep, all of those causes these fluctuations, what we call the nocturnal or diurnal changes in the hormone levels. And all this is important to maintain our normal blood pressure, maintain our blood sugar control, maintain our, the steroid levels being normal makes us, much more functional in the morning. So a lot of these physiological changes are happening during REM sleep.
What about memory consolidation? What you learned during the day, or some of the consolidation happens during sleep, right?
Yes, yes. So absolutely. And that's why, even one night of not sleeping well, the next morning, sometimes we feel not only, like that eyes are red, I have a headache, but more importantly, your ability to concentrate, your ability to remember things, all of those can be affected with just lack of one night sleep. And, you can imagine people who don't sleep well, this multiplies several fold, and that's why they get a lot of these problems.
I mean, like memory loss and cognition, chronic.
Memory loss, irritability, inability to concentrate, overall feeling fatigue, lack of interest. All of these happens when you're not getting enough sleep.
And they call about errors of omission and errors of commission. You may
Yeah,
forget things or you may do things that you don't want to do, you know.
exactly, exactly.
So I
So
think that's where that leads us into insomnia as well. Some people can't sleep or they have a medical condition that's preventing them from sleeping. And Dr. Ram, let's talk about sleep deprivation. You just mentioned that just lack of sleep, can cause so many problems. Like you said, we always ask not how much you slept, was it restful, because some people, as you know, can sleep, need longer hours of sleep. Some people have less number of hours of sleep. Somehow, at least in our profession, I don't know about other professions, it's somehow glorified if you sleep less. Do you agree?
absolutely, absolutely. It's just a macho phenomenon.
Yeah, macho phenomenon. And that's, different people have different requirements. There's no, as long as it's restful, it's fine. So if somebody hasn't slept, let's say for 16 hours, somebody may be working a long shift, go to work at 5 a.m., haven't slept till 11 p.m. or something like that. Sleep deprivation of 16 hours, what would happen?
I think it's very, very important, and it is probably the reason for several accidents that are happening, whether it's at work or on the roads or anywhere. And sleep deprivation is extremely common. Um, it's interesting. We were talking about our ancient scriptures and stuff. If somebody had asked people how many hours of sleep you need, the answer that they would have got in the 19th century would have probably been close to 8 to 9 hours for most of the adults.
Mhm.
Today, we are all shrinking our sleep time due to various reasons. Today, people are happy when they say 6 to 8 hours. And as you said, some professions, it's even lesser. But getting 6 to 8 hours of sleep, even that is not consistent for a lot of them. On an average, most adults require and probably get about 6 to 8 hours. But as you already pointed out, there is a lot of individual variation. I can give my own example. I sleep from 10 p.m. to 5 a.m. But on a day that I have to wake up at 4:30 or 4:45, I feel extremely the next day. I don't feel refreshed. I don't feel myself. And those 15 to 30 minutes can make a big difference. That deprivation of less than what my system requires makes a huge difference. And what is happening to most people is they accumulate a sleep debt. Every day they are sleeping less. And by the end of the week, they have a huge debt, like 8 hours, 10 hours. And therefore, this leads to, like number one, inability to concentrate, in the morning. Productivity comes down big time. And, like this has been talked about in the medical profession as far as errors that could happen when somebody is sleep deprived. And it can, of course, happen in any profession. A lot of the times we just read in the newspaper, somebody was sleepy while driving, and we don't even talk more about it. But that's either sleep deprivation or they have other problems like sleep apnea, but something is leading to them feeling sleepy. So it's extremely common. Even we did a recent survey where about 60% of the people said that they are sleeping 6 to 8 hours. 37% of them sleep less than that. 3% said they sleep more than 8 hours. But very, very interestingly, even amongst those who are sleeping more, not all of them are refreshed. A good one third of them were not feeling refreshed.
And there are several reasons for that. So I want to go back to, not sleeping for 16 hours. As you know, the literature shows that if you don't sleep for 16 to 17 hours, it's equal to a blood alcohol level of 0.05. And as you know, in India, the level where they would arrest you for drunk driving is 0.03. And
Yes.
in USA, it's 0.05 to 0.08. So, I mean, it's amazing the effect it has on your brain. It's equal to that of consuming alcohol to the level that you would get arrested. So I think that's very important for people to know, you know. I want to come back to your survey. Can you elaborate? I know you published it recently and it was very interesting what you found. So, just can you elaborate more on that?
Sure. I mean, we surveyed, it was just a voluntary survey, and we had well over 1,000 respondents, close to 1,200 respondents we had. A significant number of them were, like medical profession, IT profession, and students had responded. And the first thing we found was that about 60% of them said they sleep about 6 to 8 hours. And very interestingly, and this was surprising, despite having some IT professionals respond, a lot of them said they sleep between 10 p.m. and midnight, so which is quite reasonable considering the number of IT professionals that had responded to the survey. The second interesting thing we found was a lot of them said the main reason for sleep deprivation is actually job stress. That
Hmm.
was the most common reason that was quoted. Number two is using digital devices at night.
So, when you
So,
say jobs, is it job stress or being in the job? I mean, are they at
no,
work? That's why they're not sleeping, or they're just stressed
no,
out?
they clearly said it was stress related to the job.
So, they're home, but they're thinking about the job and they're stressed out, so they can't sleep. Okay, that's good to know.
So interestingly, and I don't know, this is just the Indian work culture, I think. You mentioned about them coming home,
Yes.
with the phones and people using the gadgets. Even if they are home, a lot of them are still working.
Correct.
It's not necessarily called work from home. It is just carrying work to home and continuing it. Most of them have no time to unwind, which is what, like would relieve you from the relaxation. I mean, it would help you to relax and initiate your sleep. A lot of them don't have significant time for that. So it was mainly jobs related stress that they were quoting
I
as.
agree with you. I think with the work from home situation, the work in the home, the distinction has blurred so much. Even in our profession, when we come home, we are charting, we're looking at the charts, and what we call in our profession, it's called pajama time. So you think you're home, you think you're in pajamas, you're going to go to bed, but you're really looking at patients' charts or trying to answer questions. And this blurring is what is making people burn out and stress out.
So again, like they say, divide your 24 hours into three, 8 hours of work, 8 hours of other time, family time, unwinding time, whatever it takes, and 8 hours of sleep, is what broadly, used to happen in the good old days. But today, if I talk about 8 hours of sleep or 8 hours of family time, everybody laughs at me because neither of those are happening to many people.
I just saw a lot of ruckus on the paper. Somebody saying you should work 90 hours recently.
Yes, yes,
So,
yeah. I mean, it's purely, if there is one word to describe sleep problems, it is lifestyle related. It's a lifestyle problem that we have developed over the years. In fact, even sleep apnea for that matter, a lot of it is obesity, which again is a lifestyle related problem. So, if we change our lifestyle, I think certainly it can make a huge impact on our sleep and overall health.
so can we go back to your survey? So you said what percentage of people are sleeping what? At what time are they sleeping? What is the cause of not sleeping? And I know you had six or seven aspects of it.
Yeah. So we also looked at how often people feel refreshed after waking up. And those who slept 6 to 8 hours, about two-thirds of them said that they were feeling refreshed. If they slept more than 88 hours, 70% of them said that they felt refreshed. But if they were less than 6 hours, only 35% of them were refreshed. So it goes to say once again that the 6 to 8 hours seems to be that, you know, number that most of us need to remember as adults, provides reasonable freshness for most of them. And the other thing we asked about was physically being active, and like those who were physically a lot more active seem to be obviously sleeping better at night. Here again, the work from home plays a huge role. Like people don't get sunlight, if they're sitting inside
Yes.
a space all the time, which has a huge impact on our sleep. And also, the fact that they're physically inactive, Okay, and they lose the distinction of work time and family time.
Mm.
The whole day seems to be work time, and whenever they get a chance, they sleep. I do see some patients whom all I had to tell them was remove the computer from your bedroom or you go and sleep somewhere else, and they were able to sleep better. So the mind thinks about work, the more the work environment is at home. And that's kind of what we were noticing. We also looked at how people are tracking sleep. A lot of them, a significant number of them are using sleep trackers. Now with, the fancy
Smartphones.
smartphones and smart watches that people have, a lot of them are using apps and all that. And that actually seems to hamper a lot of patients' sleep because they
They
felt
go,
that they were not sleeping without even having any other problem. And this was making them anxious that,
they're
oh, I'm
watching the watch.
watching the watch and saying that, I don't have a problem, but I'm not getting enough deep sleep seems to be a common thing that
But
a lot
just
of people.
removing that helped in some patients.
Yes, yes. And talking to them about not getting obsessed with, you know, uh, the trackers
In your
really.
practice, you said initially you were seeing maybe one patient a week or something like that. Now
Mhm.
it must be huge. A lot of people have recognized, right?
Yes, absolutely. I mean, today the complaint is the opposite that we are not getting your appointment. It is taking too long, so on an average day in an afternoon of 3 to 4 hours, I see close to 15 to 20 patients.
And
So
what is their average age in India with sleep problems? Are they mostly older people or younger people? Or?
no, it's mostly between like the mid 30s to the 50s. So that's where we see. And here, I think the IT industry, I would say, like a large chunk of them is huge in that population. And a lot of them, whether it is related to their shift work or whether it is just sheer stress of the work that I mean, you talked about the 70-hour, 90-hour thing. They work extremely long hours. And then, like even after coming home, a lot of them take calls and stuff. So definitely that seems to be having a huge impact on the sleep patterns.
So, I mean, to me, when you talk about now India is the IT hub, and back office of the world. So to me, there are two issues. Like even as physicians or nurses or whatever, we also take call in the hospital, or we may sleep there or we may work there. So there is two aspects to it, that we need to realize. One is a shift work, like your shift may be 7 p.m. to 7 a.m. So that's one issue because you're basically working when you're supposed to sleep. Second thing is, I think unlike other professions, the digital and the visual stimulation from the being on next to the screen, looking at the screen all the time, the effects are different. I mean, walking
Yes.
around taking care of other things is different than just sitting in front of a screen with all the blue light and all of the lights that are emanating. Probably has different type of effect.
That is true. And also, when you mention about, our profession or industry, factory workers and all of them, we all work rotating shifts a lot of the time. Like we may do some night shifts, some day shifts. There are times when we can cope up with it. And some cope well, some don't, even in our own profession. But the issue that I am seeing with the IT world is that they are working a fixed shift, which is the wrong time, and they are working for another country. So, for lack of better term, I would say that they are chronically jet lagged. That is what is happening because they are working at different hours. They are really not, sleeping at the right time and eating at the right time. A lot of simple, counseling, coaching, modifying their eating habits, modifying, how they sleep, when they sleep, makes a huge difference. And uh, all we do when I see a person with shift work, IT industry who has a sleep problem, we go through their entire pattern of when they are awake, when they are sleeping, when they can sleep, and all of that. And we educate them on saying that at night, if you're going to work at night, what you're eating is your breakfast, but the dinner for the rest of the world. And since it's your breakfast, you can eat, well, whereas the others are eating very small quantities because you don't want a full stomach when you're going to. And during the night time when you're working, unfortunately, they don't get good food. Most of them eat junk food at night. And we tell them, have a light lunch. And just like how I would tell a day working person, don't have caffeine or anything after about 4 or 5 p.m. Similarly, I tell them after, midnight or 1 or 2 o'clock, do not consume caffeine, do not, all those, any kind of stimulant, smoking, all of those, we tell them avoid that. And then in the morning, I always suggest that they carpool and not drive themselves because they could be tired. And I tell them that when you are on your way, if possible, use eye shades, prepare your body for the darkness because it's very bright outside and it's already sunlight. So prepare your body. And when you come home, what you are eating is your dinner, whereas it's everybody else's breakfast. So don't eat too much, eat a little bit. And once you go to bed, close the curtains, make it as dark as possible. And the most important thing is shut off your phone and give it to somebody else or leave it outside. And the reason for that is the entire world is active. They think you are awake and they're going to be calling you when in fact, your body is telling you to sleep because it's after a long hours of work. You need to sleep. And I also tell them that inform your mother, your affectionate mother, not to wake you up for lunch because like you need that continuous 6 to 7 hours of sleep and not be woken up in the afternoon because nobody eats during sleep in the night. So simple things like this do make a lot of difference to the.
I really liked, I just wanted to re-emphasize some of the points that people may kind of not pay attention is that, don't drive if you're tired, and I've seen in my own colleagues, we had a transplant fellow hit the transplant attending. They're both going home because they're both so sleepy.
Yeah.
That could be devastating. So don't do driving if you're tired. Second thing is wear dark glasses, so you're not, that bright light is not hitting you and suppressing your melatonin and everything. Third thing you said is pull the shades when you're sleeping. In noise pollution and light pollution, those are the things very, very important. So and then again, your phone being away, and just treat it like a night, because that's your night. Yeah.
I just want to, anecdotally, share something which was kind of interesting. We did all of this for an IT professional and he still couldn't sleep well. And then I just out of the blue asked him, like before you moved to night shift, what were you doing, before you go to bed? And he mentioned a TV channel and said, I always watch their 10 p.m. news before I went to bed. So then I told him, why don't you ask your wife to record the previous
Mhm.
night's 10 p.m. news and then you, watch it before you go to sleep in the next morning. And he started sleeping. So the reason this is important is sleep routines. Like all of us have something. A little child may hold on to the mother's sari. Some of us put a pillow between our legs. Some of us
Yeah.
watch certain things. Some of us listen to music. Having a good routine like that does make a difference, and we need to keep that in mind.
We are creatures of habit,
Yeah,
and to wind down, we need certain routines. Brush your teeth, wear
yeah,
pajamas, whatever it is. We try to keep it consistent.
absolutely.
All right, Ram. See ya.
Okay, thank you.
Bye.
Glad we could do this, but we'll do
Thank you.
more.
Thank you. We'll keep in touch and
Yeah.
do